Hi guys, welcome back to my channel. Today's topic I want to talk about myocardial infarction, which is the condition that known as heart attack. And without further ado, let's jump into the purpose of this presentation is to understand the definition, the root cause, the symptom, the risk factor, the pathophysiology, the diagnosis, interventions, and how to prevent heart attack. So let's start with the definition. So, again, myocardial infarction is a cardiovascular disease. So, according to Harvard Health University, they explain the definition of myocardial infarctions as a dangerous cardiovascular disease causing blockages to the coronary arteries due to atherosclerosis, a condition that fatty deposit or plaque is built up in the blood vessels, and that leads to thrombus embolism or blood clot and result in myocardial infarction. And some heart attack, commonly known as occur when the blood flows to part of the heart muscle suddenly blocked, and usually by a blood clot forming on a rupture called atherosclerotic plaque in the coronary arteries. So without oxygen, the affected heart muscle begins to die. Because of atherosclerosis condition, the heart attack sometimes do not cause blood clot formation as well. So heart attack can cause hypertension, and it deoxygenate the heart muscles, slow down the blood flow, and increasing heartbeat. People will symptomize it as a tachycardia, like fast heart rates, and blockage in the coronary arteries. So as shown in the image here, I did put it in a sequence order. When the blockage in the coronary heart arteries blocked by the fatty deposits or plaque known as atherosclerosis, and then it leads to blood clot formation. So it's called thrombus embolisms. Then the oxygenation, and it weakens the blood flow, and then increasing heart rate, tachycardia, and then dropping blood pressure, so hypertension, and leads to heart attack or myocardial infarction. When the coronary arteries got blocked, it can cause pain to the heart, and the heart muscles becomes malfunction to pump blood to regulate the heartbeat. So these case, people use electrocardiogram or ECG to observe abnormal heart rhythms. And if the rhythm of the heart is abnormal, we call it cardiac arrhythmia. So there are two types of heart attacks. And type 1, we call STEMI myocardial infarction. Type 2, we call NSTEMI myocardial infarction. So type 1, the STEMI myocardial infarction, is when the coronary arteries is completely blocked and majority of heart muscle cells, known as cardiomyocytes, it got damaged. So that indicate in the ECG, it display the ST segment elevated. So if you see the image in the left-hand side on ECG display, the ST segment is the J point. So ST segment represents the interval of the end of ventricular depolarizations and the beginning of ventricular repolarization of the heart. The coronary artery completely got blocked, and the transmural heart tissues become thicker and gets damaged. Then it triggers the release of troponin protein. So troponin protein is found inside the heart muscle cells or found inside cardiomyocytes. It helps regulate muscle contraction. When the heart muscle is injured or dying, like from the heart attack condition, the damaged cells release troponin protein into the bloodstreams. So when troponin protein leaks into the bloodstream, it acts as a cardiac biomarker. It's used to detect myocardial injuries. Higher troponin level when means that the heart muscle get more damage. And that's when the emergency reperfusion may require to treat for type 1 heart attack or the STEMI heart attack. Now move on to type 2 heart attack. We call it NSTEMI myocardial infarction, when the coronary artery is partially blocked and minor of heart muscle cells and tissue got damaged. So not like it's different from type 1. It's just partially blocked and partial of heart muscles got damaged. And there's no serious ST segment elevating on ECG. However, we see in the second image in the right-hand side in ECG display the ST segment depressions at the J point. It's a sign that the changing on the T waves. So again, we know that it's partially got blocked. The subendocardial heart tissues become damaged, and it triggered the release of troponin protein as well. But it's not like many troponin protein release into the bloodstream, just partial. So this case, the NSTEMI, they may need urgent assessment or treatment with angiography for the type 2 heart attack. So again, STEMI, in a simple way to explain, the type 1 STEMI myocardial infarction is when the ST segment elevation and fully blocked of the coronary arteries, and they need more it trigger more extensive damages, and they need emergency reperfusion. But NSTEMI myocardial infarction, there's no ST elevation. It has only ST depression and changes to T waves, and usually partial blockage, and it's still called myocardial infarction, and you need assessment and angiography. So what are the here I just explained the cardiac troponin. So cardiac troponin, a protein found inside the heart muscle cells that have regulate muscle contraction. So again, heart muscle cell, we call it cardiomyocytes, and the cardiac troponin is a protein found inside those cells. It helps for muscle contraction, and the more it leaks into the bloodstreams, the more it can detect heart injuries. So the symptoms of heart attack, including chest pain, feeling crushing or heavy pressure in the chest, tightness of the chest, squeezing, heavy to the heart. So these are the symptoms that we can observe, the sign. Feeling stabbing or burning of the heart. Feeling pain that radiate to the left arm, shoulder, neck, lower jaw, um, abdomen, and the back. So those diagnosed with myocardial infarctions, their pain may radiate to the left arm, to shoulders, to neck, to lower jaw, to abdomen area, and the back. Pain locates at the center of the chest and below the chest rib cage. So it's in the middle of the chest, the pain. And people may experience shortness of breath or breathlessness, lightheadedness, like tingling in the head, lightheaded, sweating with cold, clammy skin, nausea and vomiting, dizziness or fainting, unusual fatigue. So especially in women and older adults, for those with heart attack, they may have unusual fatigue like fainting, and then high temperature. And that's when we can notice if there's infection or sepsis can occur. Noted that the chest pain, nausea, vomiting symptoms can confuse with indigestion problems. So if you experience chest pain, nausea, vomiting, it can have two reasons, either indigestion or heart attack. So what are the risk factors influencing atherosclerosis that can lead to cause hypercholesterolemia, which make individual prone to heart attack easily because of the fatty deposit or plaque buildup in the bloodstream, causing high cholesterol. So the risk factor influence is when the hypervolemia, which means the low density lipoprotein cholesterol, is hyper, which means it's more of the bad cholesterol in your diet, the LDL cholesterol. So when you do blood tests, you can see the LDL cholesterol and HDL cholesterol. But the LDL cholesterol is one of the bad cholesterol that people should avoid or reduce in their diet. And the higher of the LDL cholesterol is the high risk of high cholesterol, which can influencing the atherosclerosis. And the more people have high cholesterol, the more they have a heart attack easily. Hypervolemia of triglycerides in the diet. Again, these are the protein that increases the risk of heart attack in the blood. Again, including not just the bad cholesterol here, it's also the good cholesterol as well. So any cholesterol that added up into the blood will contribute into atherosclerosis formations and trigger heart attack. Hypertension, those with history of having hypertension can develop heart attack easily. Diabetes, diabetes will link to heart attack because of the insulin productions and the immune system. Basically, diabetes here and the hypertension, it has connections that comorbid into heart attack. Family history of coronary artery disease at early age. So if any member in the family have had coronary artery disease, so other people inside the household probably can develop into heart attack as well. Smoking or vaping will link to heart attack. Obesity and overweight are risk factor influencing heart attack too. Physical inactivity. Women have risk of heart attack because they begin their menopause, which means when there's low estrogen hormone level, the risk of atherosclerosis is minimizing too. So if they would you say during the postmenopausal, so like after stop the menopause cycles, the estrogen levels may be low and the heart attack is also minimizing. But during their menopause age, usually they still have their menopause menstrual cycle. So the estrogen hormone can elevate it, and that's when the atherosclerosis can trigger heart attack as well. Medication side effect. So if the person use anticoagulant medication, so it will increasing the risk of to prevent bleeding. But some medication side effect it causes hypercoagulability, which means excessive bleeding. And if when it is excessive bleeding, so the plaque in the bloodstreams is higher than the red blood cells, that's when atherosclerosis form and then heart attack increasing the risk of heart attack. So diagnosed with collagen vascular disease like rheumatoid arthritis, systemic lupus erythematosus. So by lupus and rheumatoid arthritis, autoimmune disease, these are that links to the blood vessels. So disease that link to the vessels. Um, it can trigger heart attack easily. Cocaine abuse. So if a person got abused by cocaine, it can cause heart attack. Artery spasms and artery thrombus embolisms. So these are blood clot in the arteries that link to heart attack, usually for those after underwent recent surgery or surgical procedure and the blood clot forms and that's linked to heart attack easily. Family history of heart disease, and age factor. Again, for age factor, it is inevitable. So as people become older, heart attack can develop with lifestyles. Here, I want to open bracket about a type of hormone. It's called natriuretic peptide. So, atrial natriuretic peptide, or ANP, is a hormone released by the atrial, which means the upper chamber of the heart when they stretch. So that's the release because of the increasing blood pressure. So the function of this hormone, it will help the body to reduce blood pressure. It will help the hypertension to become hyper. So why it's become like that? So natriuresis is it's the hormone that increase sodium level, the sodium excretion by the kidney, and the diuresis, it increases urine production. So people will have a high water level excreted by the kidneys, and that's when they output or urinations output increasing volume, and vasodilation is widening the blood vessels, so lowering vascular resistance, reduce renin, angiotensins, aldosterone system. So if you know the abbreviation, the RAAS activity, it's to decrease the sodium and water retention. So in this case, the heart may release more of atrial natriuretic peptide hormone because of the increased chamber pressure, and the effect is insufficient against fluid overload. So the hormone is a natural ligand, we say natural counter that respond to fluid excesses. So ANP empty the tank and get rid of salts and water, while aldosterone is fill the tank, it keep the salts and water. So the pathophysiology of heart attack. The complete sequence of myocardial infarction episodes occurs when the fatty deposit or plaque blocking the coronary arteries, causing atherosclerosis, deoxygenating the blood supply, causing ischemia, and then triggers swellings to the cardiomyocytes, which are the cells in the heart, and damage the subendocardial tissue to release cardiac troponin protein. And the release of troponin protein triggers atrial thrombus embolisms to form blood clot. The troponin protein internally leaks into the blood, causing pain and malfunctions of blood pumping, and gradually reduce blood flow, decreasing blood pressure, increasing heart rate, resulting in heart attack or myocardial infarction. The series of myocardial infarction may lead to reduce of cardiac output, arrhythmia, the abnormal, heart failure, cardiogenic shock, or possible sudden cardiac death. So these are the complete sequence in order. So the simple way to explain myocardial infarction is the process when where it's reduced or blocked blood supply to the heart muscles and causes oxygen deprivation and the death to the cardiac cells. So the diagnosis of myocardial infarction, including blood test to check serum cardiac troponin protein. Cardiac troponin should less than 0.04 nanogram per milliliter, and cardiac troponin T should less than 0.01 nanogram per milliliter. So these are the two types, cardiac troponin I and the cardiac troponin T. So these are the two types of troponin protein to be checked in the blood test to observe heart attack. A high troponin does not always mean a heart attack. It can increase the other causes of heart injury, and those underlying conditions may be linked to severe heart failure or myocarditis, heart inflammation, or pulmonary embolisms, or severe infection or sepsis, or kidney disease. Another diagnosis for heart attack is to perform ECG or EKG in another word. So ECG is the electrocardiogram to observe heart muscles function, heart rhythm, the pulse rate, and oxygen supply rate. Echocardiography. The echocardiography is another way to describe for cardiac ultrasound to capture the sound wave moving with the heart image to observe the heart structure, function, blood flow, and chest pain symptoms. Coronary angiography is a heart X-ray. So they do insert the special contrast dye into the heart and then visualize the blood vessels. They want to capture the exact locations of the blockage and the numbers of blockages. And radionuclide imaging scan is to detect any poor blood flow in the heart. And these are the diagnoses for myocardial infarction. So what are the intervention for heart attack? There's specific medications, like chewable aspirin. So if advised by emergency services, aspirin need to be chewed by mouth, and antiplatelet and anticoagulant medication will help reduce blood clot and prevent bleeding. Thrombolytic or clot-busting drugs in selected cases treating acute ischemic stroke, like when there's no oxygen and people tend to have stroke or pulmonary embolism and heart attacks. So these clot-busting medication will dissolve blood clots to prevent blocking to the arteries. Beta blocker inhibit adrenalines and reduce hypertension. So it responds to high blood pressure. Calcium channel blocker for vagina, cardiac arrhythmias, and hypertension. Again, people tend to use the medications to prevent hypertension for those with a heart attack, or just in case they can develop into heart attack. Statins for hypercholesterolemia, like the medications to lower the cholesterol. ACE inhibitor for hypertension, again, relaxing blood vessels. So these are the medication to treat heart attack conditions linked to um, clotting and high cholesterol and hypertension. The surgery include emergency coronary angiography with stent placements. So we call PCI to clog heart artery, inflating the balloon and compress the plaque inside the heart. Percutaneous transluminal coronary angioplasty is the PTSCA. It's small, the flatty balloon inflate to crush the blood clot and the fatty plaque. So these are surgical procedures to prevent to treat severe myocardial infarction. So what are the preventions? Again, prevention is based on lifestyle changing, like regular exercise, and recommended to consult with occupational therapists and cardiologists if experience any symptoms listed in this video. Healthy diets, reduce cholesterol, you reduce cholesterol in the diet, fat on cholesterol, balancing weight, so not to prevent like to prevent obesity and not to gradually losing weight. So balancing the weight, quit tobacco smoking and alcohol, control blood pressure. Again, if those with already had hypertension, they need to have their regular hypertension medication to control their blood pressure, just so it cannot link to heart attack. Control cholesterol intakes. Um, Go for a heart screening appointment. Consult with the doctor for chest pain symptoms. So these are the how to prevent myocardial infarction. And it's pretty much for this presentation about heart attack condition or myocardial infarctions. See you in the next one.